Does Medicare cover dental? I mean, that's a question that I get asked so commonly, and I'm surprised on how so many people know the wrong or half of the answer. And in most cases, I would just leave it alone. But in this case, you're going to see why, how knowing the right answer can completely save your life, your wallet, and save you from unnecessary treatment. And last time I checked, dental treatment isn't something to just test or experiment with. You don't want to get a tooth pulled. The teeth are integral parts of your body. It's the only bone that is exposed in the body. And it is a very unique and natural extension of our brain and our heart, which is our teeth. They're integrally connected to our body, and they are one with our body. And so when you use that term dental, that is the word that is a trick word. And the reason why I say it like that is because in the medical insurance and the dental insurance spaces, there is a difference between what actually happens or what the patient actually needs, right? Which is the treatment or the care, the diagnosis, versus the money for the treatment or the payment for the claim or the payment for the work. Because that all happens right now from the insurance side of things, right? And the most important thing that we have to understand about insurance or any business that takes money from us is if they promise a result or if they promise that when you buy something from them, that they're going to give something back, right? And that's the whole idea of a business. But what we can't do is we can't buy a medical plan and they can't use that word dental as a reason or excuse not to cover the medical needs of the mouth. Now, a lot of people do that. A lot of people get away with it, but it's mostly because people just don't know the right way. And so, to put it simply, Medicare will pay for the surgery or the part of the treatment, even when you're getting dental implants. But it depends on why you're getting the dental implant. I mean, if the dentist is just pulling a tooth to make money from Medicare, then obviously that's a fraud. But if you have any kind of infection, if you have any kind of decay or you're losing your tooth, and instead of having the disability of losing a tooth, which no one really explains it that way, but that's the correct way to really explain. I mean, if you had a missing arm, we call those people, they have a disability. If you have a missing leg, you have a disability. If you have the inability to chew, eat, drink, or breathe even properly because you don't have your teeth, teeth aren't just for chewing. It actually even affects the way you breathe. And the way, if you don't breathe very long, you can't make it past 4 minutes. So it's intimately tied with our health and our medical needs. But people are confused because medical will not cover any dental reasons. But the reason why they created this bifurcation, I don't know, there's a lot of people that will explain it. I think that there was some health insurance company back in the day and somebody needed to start a dental insurance company because they weren't part of the health insurance company. And whether it was an uncle, cousin, Sam, or friend, or somebody that was just an enemy, they wanted to start another business. But it doesn't make it right, and it doesn't make it the best thing to do for us as patients. So what I mean is as a patient, what we want is we want to understand that when we have any kind of medical insurance or coverage, that's for us. That's not for a doctor. That's not for dental. That's not for medical. When we get medical insurance, it's for us. It's to cover our health from our head to toe. And we are the ones that should be responsible or should have ownership and access to claim our funds. It shouldn't be a hospital. It shouldn't be a dental office. And in fact, that's the way it always used to be. Just like a credit card, it would make no sense to have a credit card, give it to the cashier, when you pay for your groceries and just say, oh, just hold on to it, I'll get it when I come back. But that's what we do when we go to a hospital or when we go to a dental office. And it's okay to show your membership card, to share with them that you have an insurance card. But when it comes to actually paying your bill or verifying that they're even charging the right items, that should be something that we should be able to at least double check, right? Just like when we get our grocery receipt, and if we see items on the receipt that we didn't pay for, we would say, hey, I didn't pay for those, or, oh, hey, you charged me too much. You charged me for more than I got. Then absolutely you would want to adjust that. But the thing is we don't do that right now when it comes to medical insurance and dental insurance. And I'm going to share with you the very simple way of how to look at this and how to save yourself from paying your dentist or not just lowering your dental bill. In some cases, we can completely delete all of the dental bill. And it's by doing this one simple thing. You want to submit the medical portion of the claim or the treatment first. And not because I said it, but because that's actually the rules. I mean, medical or the health related reasons always take priority and are always the number one thing that go on at the very top. And then after the body is stable, after the heartbeat is stable, then you can go on into the vision, you know, the dental and the other things. But this is actually in our best benefit. Why? Because let me just take an average dental implant as an example. If you call across the nation, you know, I see numbers between like 3,000, 4,000, 5,000. Sometimes it's even higher, sometimes it's even lower. But let's just use 4,000 as a round number. And of this 4,000, a lot of dentists don't do this, and it's part of the problem. But to explain, let's just say of the 4,000, they spend 3,000 of that 4,000 towards the surgery. So to remove the tooth and to clean out the infection, and then to, you know, do the surgery before they actually put in the screw or the implant. That's the surgery portion. And then the implant or the metal or the ceramic or whatever material you choose, and then the fake tooth on top, again, whether it's metal or ceramic or some kind of other material that they have these days, you choose that. And let's just say that cost is 1,000. So together, 3,000 for the surgery and 1,000 for the implant. That combined cost for that dental implant surgery is $4,000, right? Or at least that's the cost that let's just say dental practice A, B, and C is charging. Okay, well, there's two ways that current dental practices do things, and they're both outdated and they're both very incomplete. I mean, it only benefits the dental office because they get paid, right? And only when they get paid. But they don't realize that there's a better way to do things, and it's actually not only hurting themselves, but it's also hurting the patients. And here's why. If they submit the medical portion of the claim first, what they'll do is, instead of asking the patient to pay, or instead of having the patient pay out of pocket, when we submit the surgery or the infection removal or any of the medically necessary parts of the treatment over to medical insurance or Medicare, they'll pay for the surgery. And usually for a single unit implant case, it's about $6,000 to $8,000. Now, I know what you might be thinking. Okay, it was 4 and the doctor just got 8. I can get 2 of them, or I don't have to pay a bill at all. Now, that's what I have to explain. It doesn't quite work like that. Insurance is very interesting and specific in the rules. Meaning, if we submit for surgery and they pay a certain amount for surgery, it can only be used for surgery. We can't use the surgery portions even if we got paid more from insurance than what a patient would pay. It doesn't mean that we can discount the fee or just take the money from insurance for surgery and use it for something else. That's insurance fraud. So what we do is we have the 6,000 to 8,000. The dentist gets paid 6,000 or 8,000, so they'll get paid more than they ever would have gotten if they got paid cash from a patient, because most patients don't have the cash to pay. And even if a patient can pay cash, they're usually paying 4,000. They're not going to pay 6,000 or 8,000. I mean, there's some practices that charge more than medical insurances would pay, but those are very few and far between. So in normal cases, the dentist receives $6,000 or $8,000, and then there's still the $1,000 left over, and then that will be covered by dental insurance, or it's just left for the patient to pay. But the beautiful thing about that is because the dentist got paid $6,000 or $8,000, and it's, you know, they were used to getting 4. I'm not going to promise you on that, but a lot of dentists in this situation, they're a lot more comfortable of giving more flexible options, or a lot of days, these days, a lot of dental practices work with other financing companies, and sometimes they even offer in-house financing to help you break down the payment if you can't make that $1,000. But right now, if you find a dentist that's doing that, that's giving that second option that I just talked about, that most other dental practices don't do. I mean, most dental practices are still stuck in practicing 70 years ago. They learned from a dentist who taught another dentist who taught another dentist, but a lot has changed since then. There's a lot of technology, there's a lot of improvements in the ways that we can make things faster, smoother, and simpler. But dentists are usually in the business of doing dentistry, as the name implies. But that should not be confused with doing business. Although practices are businesses, if we don't specialize in that area of business, then we can't assume that we're just going to magically get good at it. So the point I'm trying to make is, instead of just going to a dental office, I think the number one thing that I would recommend is, especially if you don't want to pay, the full dental bill, and if you want to get a bill like this, the two things that I would recommend is, one is you can find a Medicare credentialed dentist. That's going to be the easiest way to find people that understand this system, what I call the health starts from mouth system of doing treatment planning, of doing patient practicing or with patient care. I believe every dentist should know health starts from the mouth, but very few of them did. I've created and coined this system and this term. And the reason why I'm not even a dentist, but I created it, is because I've been working with the top dentists, teaching, coaching, and training them on how to run the business side of their practice. So I know I'm talking a little quickly here. I am going to slow it down just so you can understand this point, that the old way of doing dentistry, and 97% of dental practices are still practicing the old way, which is they're either asking patients for dental insurance first and ignoring medical insurance, or they're asking their patients for cash. Both of these are very outdated. They're very old-fashioned. I mean, it's like 50 or 70 years ago, right? I mean, today we have so many more plans, programs, layaway, coverages, and grants where you don't even have to pay, right? So even some of these plans where you can break them out over time, it's much better if you could just get a grant or a coverage that eliminates your bill entirely. And that's what I really like about Medicare. Anybody that has Medicare and they have the Part B part or written on their card, which most of them do, I think 80% of Medicare subscribers have the Part B. And if they even understood what Medicare Part B was, I think a lot more people would get it, because it does pay for the majority of the work that a dental office needs to do in that age range. I would say, from my experience working at dental offices, about 9 out of 10 patients in that 65 and older category has not just one or two medical issues. They usually have an infection with some kind of inflammation, with some kind of, other dental issues. And so given that situation and the tools we have, the best thing we can do is have a dentist do the work. No other doctor can. Get the medical portion to pay for the infection removal or any of the jaw reconstruction or any of the bone augmentation that we have to do. And then if there's any portion left over, we can have dental insurance pay it if they have dental, or we can create a special custom plan, again, through a health planner or through some special grants or programs to lower or delete that dental bill completely. And it's very possible if you just know what to do. But most people aren't insurance experts. They don't even know how to send an insurance claim. And the biggest mistake that they make is trusting that because they work at a dental office that they know how. After working at a dental office, both one that didn't do it this way and then one that did, and then asking other dental offices for the last 5 years since I've learned this if they do it too, and realizing 97% of dental offices don't. That's a national statistic and a number. It was less than 1% 5 years ago when I first started. Now it's about 3%. But as you can see, as a patient, it's almost impossible to find. So, I mean, leave that to the experts. I call myself health planner. I kind of do it here and there. It's not like my main role of a job. I'm training other people how to do that day in and day out if they want a more stable job. Health planner is a very stable job to do. I'm just pushing forward these projects and this other mission of mine because I have a much greater project that I'm working on, and the health planner is a piece of it that we need to make healthcare, dentistry, and medical run smoothly, collaborate, and do what's best for the patient. Okay, so now that you know, I mean, Medicare does cover dental, but only when used as a trick word, because you can't say it covers dental, but it covers the work that a dentist does, or the dental work that is also medically or health related. I know that's really confusing. I think the insurance companies love it that way because they want every reason, to collect money, take money, but not pay anything else. So it's a perfect system for them, but it's a horrible system for any patient that wants to be healthy and wants the insurance companies to actually pay what they're supposed to, right? But you just got to realize that's the nature of insurance, is they're going to do everything they can to basically be a crook about money. Now, it shouldn't be that way, and it isn't that way if people just knew how to properly utilize their benefits, their card, and what that even meant. But until that happens, yeah, we're going to have a big run on insurance companies where it's the executives and the people that run the companies that somehow think that all that money is theirs and that they deserve even a single penny of it, right? I mean, I don't want to digress, but anyway, point is, get your health right by doing your health planning. See a health planner before you ever see a dentist or doctor, for that matter, ever again. And just know that health starts from the mouth, and 90% of all the things that we go see a dentist or a doctor or visit a hospital for, we're better off seeing the right kind of dentist. It's not a doctor in most cases, because health starts from the mouth. And if we're ignoring dental issues that are fatal, life-threatening, and causing heart disease, a brain cancer, diabetes, and a whole host of other issues, and we're not removing that situation or treating that situation first, and instead we're treating all the second, third, and fourth situations, I mean, that's like plugging a hole on a boat but not stopping the person going around and drilling other holes into the boat. Just doesn't make any sense. So hope this topic was clear enough. Tough to share this topic right now because it is such a confusing semantical navigation, but simply know that just forget dental, and it's a lot easier that way. I mean, you need to go to a dentist, you need to go to a dental office, but just forget dental. What you are going there for are the medical needs of your mouth. And if you have any medical necessity, if you have any health related needs, if you have any infection, if you have anything remotely close to your health more than it is the teeth, then that is medically necessary, or that is health related. It's not to put a stretch on it, and it's not to make anything blur the lines. It's quite the opposite. It's too many people are underbilling and telling patients that Medicare doesn't cover the treatment at this office, when that's not true at all. Medicare will cover, in the cases and the experiences I've seen, in 65 and older, they'll cover about 9 out of 10 patients that walk through the door, and they'll cover about $6,000 to $8,000 for the surgery related portions in any like single implant case, and they can cover up to 15 to 25 grand per quadrant or per arch in a patient, and the frequency is about 24 hours. So not that you want to expand out treatment just because you get paid more, but that is the frequency, and that's what they'll pay. So if you have any questions, by the way, I can put you in a contact, or I'll put a link down below on health planners if you're a patient, on what you can do to sign up and get more information. And if you want to know more about hiring a health planner, if you're a dentist, work at a dental office, or you've considered starting a career where you can work remotely or inside a dental office, whichever you prefer, and you want to know the fastest part of the dental industry that's growing in demand and is a very consistent part, it's always been the admin, right? It's always been the office manager, because anytime a dentist and a patient meets, the two things that they absolutely must have is they need to have some kind of assistant to help them there, and they need some kind of office manager to help with the scheduling, the treatment, the payments, or some coordinations. Now, I know some offices, they try to squeeze all of this into one person, but the benefit is that we can really learn how to help not just dentists, but patients get the treatment that they want. So I hope that makes sense. Remember, health starts from the mouth, and we'll see you on the next video.